Okay, so today we're talking about the Ren. It's one of the 8 extra channels, and just like the other 8 extra channels, the way to open this channel is it needs a master and couple point. So the master point is lung 7 and the couple point is kidney 6. So as always, whenever you see a bolded statement or a colored statement in the slide, you need to remember it, because I guarantee there's going to be a quiz question or a test question. So the first one is the Ren primary channel arises below Ren 3, comma, uterus in women and lower abdomen in men. Emerges at Ren 1 in the perineum. Ascends to the midline of the abdomen, chest, and throat. Ends at Ren 24. From Ren 24, it winds around the mouth, connects with Du 28, and terminates below the eye at stomach 1. Okay, so at this point, you want to add the Ren channel to your little chart that you've been making to tell us which channels actually go to the eye. There is quite a few. The internal pathway, still talking about the primary, according to Deadman, arises in the pelvic cavity, enters the spine, and ascends along the back. Summary page, as I've already mentioned, the master point, lung 7, couple point, kidney 6. The low point is Ren 15. Crossing points are Du 28 and stomach 1. Pathologies for the Ren are leukorrhea, irregular menstruation, infertility in both women and men, a hernia, nocturnal emissions, enuresis, retention of urine, pain in the epigastric region, and lower abdomen, pain in the genital regions. The Ren low connecting channel disperses from Ren 15, disperses over the abdomen. The sure symptoms is pain in the skin of the abdomen. The shu symptoms is itching of the skin and abdomen. And it kind of forms this like upside down tree, if you will, across the abdominal region. So that leads us to our first point. Our first point is Ren 1. It's at the perineum, midway between the anus and the scrotum in men, and the anus and the posterior labia confissure in women. Regulates the anterior and posterior yin. In Chinese medicine, we have two different phrases to represent that. The anterior and posterior yin, or the 2 yin portals, is the other phrase. It drains damp heat, calms the spirit, promotes resuscitation, and revives from drowning. Obviously, you're never going to use this point that way. There's other points that will resuscitate a drowned victim other than Ren 1. Can you imagine doing Ren 1 in public for someone who's drowned? They would totally think you're crazy. Pretty sure you'll get arrested. Ren 2. So, from the umbilicus to the pubic symphysis is 5 sun total. From the belly button down to the pubic symphysis. What we generally do is we usually take the patient's hand, have the patient take their hand, make a knife hand, and you're going to place this edge right here, right on the border of the pubic symphysis. Then you can actually count it up and break it down. Once you know exactly where their symphysis is, you use their hand to figure that out. So this is 5 sun below the belly button. Benefits urination, regulates the lower jiao, warms and invigorates the kidneys. This is one of our go-to points for morbid leukorrhea, irregular menstruation, dysmenorrhea, and enuresis, nocturnal emissions, any of that stuff. Ren 3. Ren 3 is the front mu of the bladder. It is 1 sun above Ren 2 or 4 sun down from the umbilicus. Benefits the bladder, regulates qi transformation, and drains damp heat. It drains dampness and treats leukorrhea. Benefits the uterus and regulates menstruation. Dispels stagnation and benefits the lower jiao. Fortifies the kidney. So under the indications, you see a lot of the same crossover as Ren 2 with a little bit more attention to detail, such as impotence, hernia, uterine bleeding, irregular menstruation, The same thing as Ren 2 does. And then finally, pain in the lower abdomen, prolapse of the uterus, or vaginitis. Ren 4 is the front move of the small intestine. It's 2 soon up from Ren 2 or 3 soon down from the umbilicus. Fortifies the original chi and benefits essence. Tonifies and nourishes kidneys, warms and fortifies the spleen, benefits the uterus to assist in conception. Regulates the lower jiao, benefits the bladder, regulates small intestine chi, restores collapse. This is one of the most important points for fertility issues. Okay, you're going to see this a lot in the fertility protocols. Ren 5. Ren 5 is the front move of the Sanjiao. It is 2 soon from the umbilicus, 3 soon up from Ren 2. Moves and benefits the water passages, regulates qi and alleviates pain, regulates the uterus. Ren 6. Ren 6 is 1.5 soon inferior to the umbilicus, 3.5 soon from the superior to the pubic symphysis. Everything up until this point has been 1 soon. Now it's 1 soon and a half. Fosters original qi, tonifies kidney and fortifies yang, rescues collapse of yang, regulates qi and harmonizes the blood. Quite literally, Ren 6 is probably one of your go-to points for anything for blood, qi, kidneys, and yang. Hands down. Ren 7. Ren 7 is 1 soon inferior to the umbilicus or 4 soon up from Ren 2. Regulates menstruation, benefits the lower abdomen and genital regions. Not anything unusual. Paritus vulva is extreme itching of the genitals. So that's more for an STD. So there is a crossover of using Ren 7 with STDs. Just putting that on your radar. Ren 8. Ren 8 is the belly button. It's also translated to the spirit's gate. In Taoism and in Buddhism, we believe the soul of the baby travels down the umbilicus. That's how the soul enters the body. That's hence the name, spirit gate. Ren 8 is counterindicated for needling. We only do moxa here. All the different styles of moxa, straight moxa on futsa, moxa on salt, moxa on ginger. All those have a different result. So this one, by using moxa in those different aspects, you can warm the yang and rescue collapse, warm and harmonizes the intestines. Ren 9. Okay, so now we come up to the sternocostal angle, right up here. From the sternocostal angle to the belly button is 8 soon. Okay, so this is 1 soon up from Ren 8. We're following a pattern up the center of the body. Regulates the water passages, treats edema, harmonizes the intestines, and dispels accumulation. The name actually translates to water divide. It's all about water. Ren 10. Ren 10 is 2 above the umbilicus or 6 down from the sternocostal angle. Harmonizes the stomach and regulates qi. Dispels food stagnation. In fact, it's actually one of the stronger points for food stagnation, right? The holidays are coming up, so most of America is prone to overeating on Thanksgiving. So this is your go-to point for that. Ren 11 is 3 above the umbilicus or 5 from the sternocostal angle. Harmonizes the middle jiao and regulates qi. That's all it does. But it's also one of our best points for anorexia. This, combined with some of the UB points that we talked about a couple of weeks ago, is actually how we treat anorexia. Ren 12. The front move of the stomach and the influential point or meeting point of the fu, the yang organs. It's 4 soon above the umbilicus, midway between the umbilicus and the sternocostal angle. It's actually, that entire measurement is 8, it's 4 up or 4 down. Harmonizes the middle jiao and descends rebellion, tonifies the stomach and fortifies the spleen, regulates qi and alleviates pain. There are no surprises on the indications. Ren 13. Ren 13 is 5 above the belly button, 5 above the belly button or 3 below the sternocostal angle. Harmonizes and regulates the intestines. Scratch that. Harmonizes and regulates the stomach qi. Descends rebellion and alleviates vomiting, regulates the heart. Ren 14 is the front mu of the heart, which is 6 above the belly button or umbilicus, 2 below the sternocostal angle. Regulates the heart and alleviates pain, descends lung qi, unbinds the chest, transforms phlegm and calms the spirit, harmonizes the stomach and descends rebellion. And the indications really reinforce that. Pain in the cardiac region and chest, nausea, acid regurgitation, difficulty swallowing, mental disorders, palpitations, epilepsy, they echo each other. Epilepsy is really about transforming phlegm and calming the spirit, just like mental disorders. Mental disorders is always an element of a disturbed shin and phlegm. Ren 15. Ren 15 is the low point of the Renmai. It is 7 sun above the umbilicus, 1 sun below sternocostal angle. Regulates the heart and calms the spirit, descends lung qi and unbinds the chest. Again, some similar functions to Ren 14. Ren 16. On the midline of the sternum at the level of the sternocostal angle. It only does 2 things. Unbinds the chest, regulates the stomach, and descends rebellion, right? Anorexia is basically a learned behavior in which we encourage rebellious qi in the form of vomiting, right? So if you look straight across in the indications, you have hiccup, nausea, anorexia, which are all 3 rebellious qis, rebellious qi types. What's missing is the cough, wheeze. Those are the only 2 other rebellious qi that this does not treat, because those are more lung in nature. Okay. Ren 17. Ren 17 is the front mu of the pericardium. It's also the meeting point of qi. It's directly, if you look at this, it's the level of the nipples, right? So wherever the nipples fall, it's right here on the sternum. On the midline in the sternum, in depression level with the junction of the 4th intercostal space of the sternum. Regulates qi and unbinds the chest, descends rebellion of the lung and stomach, benefits gathering qi, benefits the breast, and promotes lactation. 18. 18 is the 3rd intercostal space. Unbinds the chest, regulates and descends qi. Again, for rebellious qi, cough, asthma, vomiting. 19 is the 2nd intercostal space. Unbinds the chest, regulates and descends qi, just like 18 did. 20 is the 1st intercostal space. Does the exact same thing as 19 and 18. 21 is the midway between 22. 22 is right here in where the collarbones attach to your sternum. That's 22. 21 is the 1st intercostal space. 0 space. 21 is halfway in between those 2. Descends stomach qi, dispels food accumulation, unbinds the chest, descends lung qi, benefits the throat. 22. 22 is the window of the heaven point. It's on the midline in the center of the suprasternal fossa, which is where the 2 collarbones attach, that little space right here. It is 0.5 sun superior to the supraterminal notch, right? So what you do is you're going to needle into that, and then You're going to turn the angle like this, and you're going to slip that needle on the underside of the breastbone to hit the thymus gland. Descends rebellious qi, alleviates cough and wheeze, benefits the throat and voice. Now, like I just mentioned, you'd actually go into that point and then thread it down behind the breastbone to hit your thymus gland. That is done for autoimmune conditions. People who need more T4 and T3 cells, that's how we do it. Is we want to hit the thymus underneath. 23. 23 is right here on the anterior midline of the neck, any depression above the hyoid bone. Benefits the tongue, descends qi, and alleviates cough. This is all about swelling and pain in the subglacial region. Any problems about salivating, things like that. Aphasia with stiffness of the tongue called by apoxia, sudden hoarseness of voice, difficulty swallowing. It's all about the throat. Throat and tongue. 24. This is proof that the Chinese actually have a sense of humor. The translation of this point, Ren 24, is called sauce receptacle, which just makes me crack up every time I have to say it. Above the chin in the depression in the center of the medial growth, right here. Extinguishes face wind and benefits the face. Regulates the renmai, or conception vessel. Most everything you see here is all about local tissue, except for the mental disorders. And that's the end of the presentation. Oh, that was fast. Yep, that was it.